I've not seen it this bad, but we know that over the years, there has been a shortage of nurses in Ontario, particularly registered nurses. Our quota has been less than other provinces. So this is certainly a dire and a dangerous situation that needs drastic responses from our politicians. And we, as RNAO members and other health professionals, are ready to sit at the table and talk about a comprehensive and long-term recruitment and retention strategy.
And that was Claudette Holloway, president of the Registered Nurses Association of Ontario, who we spoke with just earlier in the show. Growing calls for the Ford government to address staffing issues in the province's emergency rooms and ICUs.
And joining us now live is Health Minister Sylvie Jones to discuss more about this. Minister Jones, thanks for joining us this afternoon. Now, I just want to sort of recap for our viewers. We received a couple of statements from your representatives last week in response to our questions outlining a number of government programs to address the healthcare shortages. Now, many of these programs were certainly announced months ago, but specifically, are these programs working? And if they are, then why are there these staffing challenges in the ICUs and emergency rooms seeing these closures?
Well, for sure, the programs are working because we have over 10,000 new nurses, new healthcare providers working in the province of Ontario. It's the largest investment we've seen in the last 4 years, historic investments in Ontario. We've seen over 600 internationally trained healthcare providers who are now working in 60-plus hospitals in Ontario. The shortage of healthcare workers in the province of Ontario is not unique to Ontario, Canada, unfortunately the world. We are seeing these shortages. And so having organizations who want to work with us, who want to have those solutions brought forward, it's been very gratifying in the last number of weeks. Without a doubt, hospitals are challenged when they cannot fill their shifts, but we also hear from hospital CEOs that say, we need a robust home care system. We need a robust long-term care system. So the ability for all of these different organizations to work together and acknowledge that together we will solve the healthcare shortage in Ontario is really critical.
And Minister Jones, are more short-term immediate emergency measures needed given that ICUs and emergency rooms are really closing in many hospitals across the province this long weekend? 24 hospitals had to shut down several departments. Now, your representative advises that your government is, quote, working proactively with all partners, including Ontario Health and the 141 hospital corporations, the regulatory colleges and healthcare sector unions to address all these staffing pressures, and this includes identifying solutions for both the short term and the long term. So I think what we want to know specifically are what are these short term measures that are going to fix the problem that we're seeing today?
Yeah, Jennifer, it's a great point. Look, independent health facilities, hospitals, it's always a very challenging decision when they have to shut down an emergency department, whether it's for 4 hours, one shift, or in some cases over the weekend. I know that it is very challenging for them to do this and make those determinations. However, I want to reassure people that Ontario Health is a major part of the plan to work with those local hospitals to make sure that they have the capacity, and all of the options have been put on the table. When you have healthcare organizations working together, when you have Ontario Health finding health human resources, physicians and nurses prepared to travel distances to fill that ER and make sure that that emergency department can stay open. It's very gratifying. Still very disturbing to have an emergency department shut down, as I said, whether it's for 4 hours or for a shift. But I want to reassure people that there has been much work already, and we will continue to expand that capacity that we need in Ontario to make sure that whether you are accessing care in your home through home care, in a long-term care facility, at your primary care doc or a hospital, the resources and the health human resources are there when you need it.
Minister, respectfully, I'm not really hearing a whole lot of urgency here in what you're saying here. Is it accept to you, as the Minister of Health in this province, that we are seeing this many closures temporarily, weekends, et cetera, at hospitals, at ERs, at ICUs? Is that acceptable?
So, Nick, I can tell you that working with all of the partners that are involved in this situation, whether it is the College of Nurses, the RNAO, the hospital, the OMA, all of them together understand the urgency and are bringing forward solutions. We've done a lot in the province of Ontario. Over 10,500 new healthcare workers are working in the province of Ontario that weren't working here 3 or 4 years ago. We have over 600 new internationally trained healthcare providers working in hospitals in Ontario that we didn't have 3 or 4 years ago. Can we do more? Absolutely, and we will do more. But I have never seen the level of cooperation between the various organizations that really play a critical part in making sure that our capacity is here.
Okay, is it acceptable to you as a health minister of the province of Ontario, though, that we are seeing closures and shutdowns of ICUs and emergency rooms? That's really the answer we're looking for.
I can assure you that all of the partners together are working to make sure that we see fewer and fewer of these shortages, because we know how important it is for local communities to have an emergency department in their community open when we need it.
Mm-hmm. Minister Jones, you mentioned that it's very gratifying working with several of these organizations to help fix this problem. Is one of the organizations you're working with the Registered Nurses Association of Ontario? Because they seem to feel like they're in the dark, that they're not part of the conversation. They're eager to talk to you. They have solutions on the table, including, of course, the repealing of Bill 124 and several other things. Have you spoken to them? And why won't the Ford government repeal Bill 124?
So I have spoken to a number of nursing organizations, Doris Greenspan, of course, Catherine, and we'll continue those conversations as we bring forward ideas and solutions, because I know that the only way this will work is if all of the organizations understand their role and how we can improve it in Ontario.
What is your message to Ontarians, Minister, when it comes to potentially visiting ERs? Because, just anecdotally, even over the weekend, this came up in a lot of conversations I was having with people. People are telling me they don't want to go to ERs. They're worried about what would happen if they needed emergency care in this province. And with, 24 hospitals facing shutdowns or temporary closures, that doesn't give a lot of confidence to Ontarians that they're going to get the care they need in a timely manner.
So almost 90%, 88% of individuals who visit an emergency room department have their issue dealt with within an acceptable amount of time, which is from in the door to finished 8 hours. We have a robust system. When an emergency department must close for a period of time, we have redirects so that people understand, emergency personnel understand where that patient needs to go. If you need to visit an emergency department in the province of Ontario, you will be well looked after, and please look after your health and do that if you need it.
Mm-hmm. And Minister Jones, just a personal question to you. If you're a patient and you go to an ER for an issue that is you deem an emergency and that is very pressing, do you think waiting 8 hours is an acceptable amount of time?
I didn't say waiting 8 hours. I said from walking in to having treatment to having assessment, 8 hours. That is the full length of when you walk in to when you walk out. And as I said, 88% of the people in Ontario who walk into an emergency room have that high level of competency.
Do you have a timeline, Minister, of when things are going to improve, when we may not see issues like this over weekends, when some 24 hospitals are having these temporary shortages or shutdowns? Do you have a sense of when this is going to improve?
So as you can imagine, Nick, it is very fluid, very individual to the hospital. And what we are finding is there is absolutely a higher vacancy rate right now because of vacations, because frankly, if you're sick, then you should not be going in and working your shift in an emergency department. So we'll work through those with Ontario Health to make sure those individual hospitals have the coverage where and when they need it. But in terms of a timeline, that's very hard to monitor and judge.
Who is more responsible for sort of the management here? Is it Ontario Health or is it your ministry?
Well, obviously, we work very closely together. Ontario Health has a lot of the local knowledge in terms of where family docs, where doctors and nurses are that are willing to be redeployed for a period of time to cover off those short emergency shifts when needed.
And Minister Jones, I just want to circle back to the question I had about Bill 124 and how it pertains to retention and recruitment of frontline staff. Dr. Michael Warner, ICU physician, has said that, full-time ICU nursing jobs would be easier to fill if critical care nurses, who must have extra training, were paid a premium for the expertise they bring to the bedside. Is there anything in the works to, take that into account and to actually repeal Bill 124, give these nurses their 10 paid sick days as well?
So as you know, Jennifer, there was a substantial investment to ensure that full-time nurses working in the system were compensated for the very challenging times that they have had over the last number of years, and that was a $5,000 retention payment. The second final payment is coming out in early September. We have acknowledged that throughout the COVID pandemic, nurses and other healthcare practitioners have been expected to do a lot of additional work, and we acknowledge that through that $5,000 retention pay.
All right, Provincial Health Minister Sylvia Jones.